Medical and life sciences infrastructure is not just a matter of buying equipment. It is a system that supports continuous healthcare services, laboratory testing, biopharmaceutical production, sample storage, and cold chain operations. In hospitals, laboratories, biopharmaceutical facilities, vaccine storage, blood banks, and research centers, continuity, environmental stability, data reliability, and traceability directly affect patient safety, sample quality, test results, production batches, and operational risk. The value of these systems is not simply keeping equipment powered on. When power interruptions, temperature drift, network outages, environmental deviations, or system faults occur, they help critical operations continue in a safe, stable, and controlled manner. The power chain begins with utility interface and automatic transfer switching. ATS panels connect the main utility supply with backup sources, allowing critical facilities to transfer power reliably before downstream UPS and distribution systems take over. UPS systems provide uninterrupted power and short-term bridging capacity. They reduce momentary interruptions, stabilize voltage and frequency, and support critical areas such as ICUs, operating rooms, laboratories, server rooms, and control rooms. Battery energy storage provides backup runtime for UPS systems and controlled shutdown windows for critical loads. Backup generators extend resilience during longer outages, helping hospitals, cold rooms, production areas, and data spaces remain operational. Critical power distribution safely and clearly delivers electricity to key loads. In operating rooms, ICUs, laboratories, cold chain rooms, and data areas, isolated power panels and monitored circuits help reduce leakage risk and fault propagation. Surge protection, grounding, budway, and critical cabling reduce lightning, surge, interference, and equipment damage risks. They also support stable power transmission, clear routing, maintainability, and future expansion. Racks and enclosures provide the physical structure for installation, cable management, airflow, access control, and maintenance. They help keep IT, control, and monitoring equipment organized, protected, and serviceable. Precision cooling keeps equipment and critical spaces within stable operating windows. Cleanroom airflow intersects support cleanliness levels, pressure stability, and contamination control in GMP areas, sterile rooms, and controlled laboratory environment. Environmental monitoring collects real-time data for temperature, humidity, pressure, particles, leaks, and other key parameters. Proper sensor placement, calibration, alerting, and response workflows turn raw readings into operational control. Core and access networks connect monitoring devices, terminals, platforms, and business systems. Secure Wireless supports mobile care, inspection, asset connectivity, and temporary access, while edge servers provide local computing, captioning, and control logic. Storage and backup systems protect images, records, sample data, and operation logs. IoT gates and protocol integration connect field devices to upper platforms, while DCM, BMS, and EMS enable visualization, trend analysis, linkage control, reporting, and audit support. Access control, video audit, cold chain monitoring, and RTLS protect sensitive areas, samples, drugs, vaccines, blood products, and critical assets. They help control permittance, visualize asset location, record temperature history, and support traceable response. In a general hospital campus, the focus is unified power, monitoring, alarms, and scalable networks across buildings and load types. Operating rooms and ICUs require isolated power, UPS support, fast transfer, and critical alarms. Clinical laboratories depend on stable power, environmental records, reliable networks, and data retention. Molecular, PCR, and BSL laboratories rely on controlled environments, stable pressure, clear process boundaries, access control, and traceable logs. Power, environmental monitoring, doors, alarms, and records must work together to reduce operational and compliance risk. In biopharmaceutical production and sterilized support areas, infrastructure protects production continuity, environmental consistency, traceability, and minimal downtime. Power, monitoring, alarms, and maintenance bypass strategies help prevent batch interruption, deviation, and incomplete record. Vaccine storage, drug cold rooms, blood banks, and biobanks require continuous temperature recording, backup power, remote alarms, asset location, and complete records. These systems help prevent temperature drift, audit-related loss, misplaced samples, and audit gap. Imaging and PPAPs data rooms need stable power, precision cooling, redundant storage, and reliable networks to avoid image access interruption, data damage, and slow recovery. Remote clinics and mobile medical units require fast depletion, edge operation, backup power, and remote management. Research laboratories and pliant facilities need modular expansion, flexible distribution, and recordable environments. Emergency command and disaster recovery require backup power, data protection, centralized alarms, network redundancy, and tested recovery paths. Selection should begin with system logic, not isolated product specification. For medical and life sciences facilities, selection should consider redundancy, maintainable distribution, continuous monitoring, network isolator, backup and enclosure, expansion space, and audit evidence. The goal is coordinated design across powers, enabling uninterrupted service, predictable risk, traceable events, executive maintenance, and sustainable growth.